Hello everybody, my name's Annette Willson, and in this short little webinar I'm just going to introduce myself and talk to you about rider biomechanics. So my business is applied posture riding, and basically I look at training the core problem in horse riders. So we're going to be introducing you to the topic of rider biomechanics, which is becoming a very popular topic in Australia with riders, certainly very popular overseas. And rider biomechanics goes very well with my business, which is applied posture riding. So just first up, who am I and what do I do? Well, I'm a physiotherapist. I have got a master's degree in physiotherapy, but my career started a long time ago in horse riding. I was an event rider. We started in the days where rules weren't quite so strict, and certainly there wasn't the information available to people as it is today. So I've retired from that aspect of my riding. I still train horses, and I'm a rider coach, so I do train in dressage, cross country and show jumping. But my specialty is functional movement and rider biomechanics. I've certainly got the experience, the education, and sadly I've also got a lot of injuries that I can draw from. So that's who I am, what my credentials are, and what I do. Just want to talk to you about what biomechanics is. It's actually just the study of movement. So if you're going to move your elbow into a bent and a straight movement pattern, the study of how you do that is the study of biomechanics. So rider biomechanics is the study of how the rider moves, so rider's movement. So how you engage your lower leg, how you sit deep, how you move your pelvis. So it's very specific and mechanical in studying how a rider moves when riding. So it's applying the correct movement patterns to riding after you understand what they are. Now, some of the elite riders I've been talking to say they don't need to learn how to ride. Well, certainly they've got very good skills, but if we apply rider biomechanics to their already efficient skills, they can be much better. And certainly for learner riders, we can train patterns rather than habits. And we can train these patterns out unmounted to become effective mounted. Now, riding's one of the most unique biomechanical setups in that we ride, we work our body totally different to every other sport. We do not run and jump and spin and turn. We sit basically in what's called a static posture. It's certainly not static, but we want to appear still. So that is very unique to riding. And it's also one of the few sports that allows men and women to compete equally. And it attracts all types of body shapes and sizes. So if you're a tall, thin man or woman, short, fat man or woman, old or young, you are still able to ride. And that's the beauty of our sport. So why is rider biomechanics an important topic? Well, it actually teaches riders how to connect to their horse, and it's more so than sit deep, put your leg back. It teaches correct posture. Now, there are very many good instructors that already do that. Sit up straight, put your leg here, but rider biomechanics goes into more detail how you actually put your leg there. So it trains riders for better skilled riding, for better balance and safety, and for more comfort in their horse. So you can see in the two pictures here, any good instructor would be able to say with this rider, bring your leg back in under your hip, because we all know that that's the correct alignment. Very many riders can do that when they're standing still, but they can't apply that muscle and the other skills required to be able to achieve it. So rider biomechanics can teach people how to do that out of the saddle and in the saddle. So before we look at teaching it, we actually have to know what are the biomechanics for riding. Now, some of this is certainly not new information, and the wording may just be a different jargon, We want symmetry through your whole body. You want to be able to apply equal left and right leg, equal left and right seat bone, equal left and right hand aids. You want to have stability through your lower legs, your seat and your hands. You want to have active flexibility through your spine and your hips. You want strength and endurance, not necessarily power, through all of your riding muscles. Now, endurance is different to power, and it is a different muscle action. So part of the unique aspects of biomechanics for riding is this endurance with power, not strength with movement. We have to have an independent, isolated skill through your seat, your legs and your hands. We also need to have a combined movement body control. So if you're going to do a leg hand aid, obviously with your seat, you want to be able to combine those movement patterns. So the skill of isometric muscle movement body control, in a nutshell, is your ability to be able to sit upright but still be able to use your hands and your feet independently of your seat and your trunk. So these are the, if we look at what biomechanics is how you are moving in the saddle and how you're applying your aids. So how to apply it to rider biomechanics to you? Well, first up, you need to know a little bit more about your own body. If you are stiff, then you need to stretch. If you are weak, you need to strengthen. If you lack endurance, you need to train endurance, because when you get in the saddle, if you lack these abilities or skills, you're not going to be able to apply your aids as they are designed. If you've got a muscle imbalance, say, look at this picture here, this person here's got, it's the serratus anterior muscle, which is the muscle that holds the shoulder blade on the rib cage. Now, if you've got a muscle imbalance like that, there's no way you're going to be able to fix that in the saddle. This girl here, she's had a baby with a separation. She's not going to fix that in the saddle. Now, most people know this, but they still try and ride and expect more from their horses and not from themselves prior to, so they prepare first. If you've got pain, you need to rehab your injury. And you actually need to learn what the mechanics of riding are. So it's a little bit more complicated than just get on and sit up straight. Now, you can train a lot of these mechanics of riding, certainly in the saddle, but you can do a lot out of the saddle. And you want to apply those skills both in and out of the saddles as part of your training. Now, if you have a look here, I've got some pictures, very common rider problems. And the most common problem I see is the lower leg. People push through their toes, they use the stirrup as a platform, and they lose the mechanics of all of the muscles. Now, just about in every one of these photos, you can see that the lower leg is not remaining in the position that we set it up and we want it to remain. So the skill of how you do this is not as easy as it seems. And the more your lower leg becomes a platform that swings around, the less stable we are in the saddle with our hands, and certainly we don't have any functional use for our seat. So the most common rider problem I see is the lower leg, and then the second consequence of the lower leg is the hand and certainly the seat. Now, if we look at the biomechanical analysis of a rider, I'll just go through this quite quickly. Many instructors are able to identify these and certainly suggests how to come out of these postures, but not necessarily how to fix them long term. The shoulders, we have tight muscles in the front. We have a hyperactivity between the shoulder and the ear, which is our trapezius. Now, if you've got that in your daily life, you're going to transfer that to your riding. So you can't fix that in the saddle. In the hand, if you are constantly bending your wrist, there's a movement pattern that goes with that. You will then bend your elbow and often bring your shoulder forward. And many instructors will say, stop fiddling with your hands and sit up straight. Yes, you may do that, but how long do you keep it for? If you've got poor control, poor strength and poor endurance through your abs and your core muscle, then you very you don't have any strength through your trunk, and you're very likely to be unstable in the saddle. If you've got some incoordination through your hips and your spinal extensors, then again, that imbalance is going to show up in your riding, where you're not able to use your seat properly. If you have a gripping action through your thigh, we all know that tends to push us out of the saddle. How to relax, but how to strengthen these muscles and use them functionally is what you're going to train. Your foot, the ankle must be in what we call a flexion. And something that instructors don't know, which is a biomechanical feature of the lower leg, is when we walk, we push off through our toes. When we rise trot, we push off through our toes. So you have to inhibit that action so that the lower leg remains next to the horse, but also deeper through the heel than it is through the toes. So that is an inhibition of a normal action and the training of a unique action specific for riding. So as I said, many are able to, of your instructors are able to identify your problems, because there's a lot of good instructors out there that certainly can know what good riding is, but not necessarily how to teach it unmounted. Sit up straight, stop bouncing, use your core, keep your legs still, breathe's a good one, and stop fiddling. These are many of the rider common habits. And yes, suggesting people how to, or instructing them how to stop that is good, but it seems to be not a long-term fix. So we need to understand what the biomechanical principles are. And here's just a simple couple of examples. The hamstring bends the knee. So if you're going to keep your heel in line with your hip and your shoulder, you have to have an active hamstring. So if we take away the action of, as I said before, pushing through your toes, which tends to work with the quads muscle, and that will straighten your leg, it will also make your leg go forward. So having your hamstring engaged with your core is one of the biomechanical movements in applying to riding. Now, all of us are affected in some way by injury, childbirth. We've had an incident that causes fear, and certainly age. This has a direct effect on your riding skills. And if it hasn't happened yet, more than likely as you get older, hopefully it won't happen, but most likely it will. Most end up with poor balance, poor skills, and certainly poor results with our riding. We alter the way we ride when we have an injury after children, and certainly with fear. Now, that's not, as long as you acknowledge that and address it, so you can then train yourself not to have reactive habits or defensive riding, because the concern then is it affects your riding, your riding then affects your horse. And you'll see many cases, once people return to riding after an injury, somehow their horse is affected, either through pulling on the bit here, I mean that's an animation, bouncing in the saddle, resistance, bad behaviour. It all affects our horse, and this is the result of, in many cases, people returning with poor rehab after an injury. Now, if we look at some of the common poor postures, here's the most common, again, comes back to the lower leg. If you've got flexible, flat feet, you need to look at, have a physio help you with this, because you can't fix this on your own and you can't fix it in the saddle. Now, the reason I've got this in here is because it's so common. Now, the flat feet is not the problem. The cause and effect of your knee and your hip and the placement and the stiffness and the imbalances it causes through your hips and your pelvis. So flexible flat feet directly affects your skills in riding because it affects your hips. Now here we've just got a girl who, coming in and out of these different postures. If you've got some of these postures in your daily life, they're going to directly affect the way you're riding, and you will not fix them in the saddle. If you have a weak core, slumped shoulders, it will directly affect how you sit in the saddle. So there's just another example. And you won't be able to maintain this in the saddle. You have to train these muscles and the habits out of the saddle. Now, some of the poor postures that we all adapt will directly affect, we're talking at rider biomechanics here. If you're going to sit around slumped with a soft, sloppy posture, more than likely you haven't developed the strength for an upright posture. Therefore, your ability to achieve that in the saddle is not going to be achieved successfully. Now, not only are these postures that are not conducive to building muscle tone and the upright habits that we want, or the skills, this also puts pressure on structures, particularly the disc in your back, and that can cause injury, and these injuries lead to bad or inhibition of your core muscle and lead to muscle imbalances. Now, running also causes a stress through the back. Now, don't not run if you run, but have a look at the biomechanical setup. Here we've got someone with a very tight low back, and certainly it's a graphic, and it changes the position of the pelvis. Now, if you're walking around with a position that is not neutral, you're going to ride with a non-neutral pelvis. So some of the movement patterns that are essential for riding, you must be able to engage your core on demand. So if you're sitting trot and your instructor says more core, if you've got the skill to do this, then you will certainly achieve a better quality sit trot almost immediately. You must be able to tilt your pelvis forwards and backwards, but you have to have a core support to be able to do that. You must be able to independently isolate movement in your hand, your seat, and your feet with combinations of movement and in isolation. So these are some of the biomechanical movements that are absolutely essential for riding that are not necessarily essential for other sports. Now, just for example, here I've got some pictures of the core muscle. Now, this webinar is not about that, but I just want to introduce you to the importance of this muscle and how you can isolate it. In all fours, if with no engagement, the muscle will drop down, sort of a cow look. You can then engage the muscle anti-gravity, as in these two pictures, by using your breath. So you can blow and engage your core, and that's one of the first movement patterns that I teach in isolation, to have the skill of independent core engagement on demand. So it's a functional core movement pattern, absolutely essential for good posture, but absolutely essential for good riding. Now, the pelvic tilt, as I discussed, you need to be able to maintain neutral and what we call a posterior tilt and an anterior tilt. Now, neutral, we have a balance between the front and the back muscles. Certainly core hold. Here we've got abs coming in, and here we've got back extensors. Now, the ability to isolate that without the upper body following, or the lower leg following, is a skill or biomechanical skill of riding. So to apply biomechanics to your riding, you can do exercises to train the movement patterns. Now, moving on from being able to use your core, exercises that strengthen, stretch, and build the musculoskeletal structures. These aren't specific for riding in many cases, but there are very many that are specific for riding. So this is an exercise, basically a Pilates exercise. Now here, what I've given is a movement pattern from sit to stand. So a biomechanical rider pattern is training sit to stand, which is the rising trot movement pattern. Now, of course, doing it off the ball is not the same, but it's a similar setup of the biomechanical structures on how to do it. So we can apply exercise and movement patterns out of the saddle. Here's another one. If you are standing on one leg, and this is one of the tests I do, you can stand on one leg with the biomechanical setup completely wrong, or you can stand on one leg with the biomechanical setup completely right. So here we've got core, we've got correct alignment, the pelvis is remaining stable, shoulders are remaining stable, and there's no rotation. There is a movement in transfer of weight. So having a look at what is the biomechanical correct way of movement is very important if you're going to start training yourself for riding specifically. As I've mentioned, tilting your pelvis, being able to extend and rotate your trunk, being able to bend, flex, and move your hips in and out in rotation and away and forwards and backwards. And being able to isolate those movements is very important. Knee flexion, extension, stability through your core to apply all of these movements, and certainly being able to do them symmetrically and controlled asymmetrically. Here's just a couple of examples. If you're sitting in the saddle, being able to, again, this is static, it's not moving, hold your hands. Here's an exercise you can do on the ball. If we want to practice having independent isolation of the shoulder, certainly this is not a movement you're going to do in a dressage test. It's a movement pattern training technique. You can train it in the saddle, you can train it on the ball, and you can apply it, this is inside rein to outside rein. So each of these movement patterns has a setup. It is a setup to apply when you want to start training your horse. Now, often I get, why is Pilates not enough? Now, Pilates is certainly an excellent exercise regime to strengthen your core, strengthen your posture, and it's very good for structural alignment, but it doesn't necessarily train you specifically for horse riding. Pilates doesn't really train you for any sport specifically, but it is very good for strengthening. But if you want to move on from good strength through your core and posture to riding, you need to apply the movement patterns for riding, and Pilates doesn't necessarily do that. Now, the other thing Pilates is very strong on is that all of your work is done in neutral spine. And that's an excellent way to train your body, but you have to be able to move in and out of neutral spine with functional core hold. The other thing, Pilates doesn't train self-carriage for riding, so these isometric or static postures. If you're doing Pilates, keep doing it, but add in the biomechanical movements that are specific for riding. Now, many people do Pilates, and I've said they do have great success. And as I said, instructors are able to identify these core patterns and train sit up straight, put your lower leg. But these are the end results. So training the steps is required. So a deeper level of assessing and training is needed. So if you want to apply biomechanics to your riding, you certainly need to have knowledge of your own body. And as I said before, you need to be able to know whether you're stiff or you're weak or you haven't got good core function. You also need to understand what influence injury, childbirth, age, and other activities that happen normally have on your body. So you need to have, basically you need to have an assessment. So if you want to apply the movement patterns in the saddle through all the paces, you need to be able to achieve good balance, symmetry, and this takes an understanding of what your starting point is with your body. So that brings us to a little bit of a bit more about me and the services that I offer, both locally, unmounted, and certainly online. Now, being a physio, I don't only treat horse riders, but I specialise in horse riders. Now, people that come to me, we do a full body assessment. We look at their posture, their strength, their length, their weaknesses. If we need a diagnosis on an injury, certainly we can, after an assessment. If people need treatment, we apply that. But most people and every single person with some sort of injury does need rehabilitation. So normal physiotherapy services. But if I'm treating someone or looking at someone explicit for riding, to go through a full look at all the riding muscles, length, strength, endurance, and symmetry, their ability to control those movements. So we do that in an assessment. Certainly start any rehabilitation with exercises, but I also apply the functional core movement training specific for riding. Now, just like every sport, riding has its own specific movement patterns. If you're going to play tennis, you will do lots of lobs and repeated movements through the dominant hand with the tennis racket. And we need to do that through both sides of our body so that we achieve symmetry. And that is specific for horse riding. We can look at your posture mounted. Now, not everybody needs an unmounted assessment. They just need tweaking up in the saddle, retrain some of the habits. So that's another service that I offer. Dressage and jumping, horse training and horse rehabilitation, all just based on the credentials of my history with my physio knowledge and my experience in the industry. So some of the products that I use with people, this is a core sensory belt. This is not a support belt. When we've got somebody with a good core but they're forgetting to use it, this little belt it's designed by me and manufactured by me to engage the core. So it's a core reminder. Do have a lot of people that are weak through their upper body. Again, we don't put a brace on to keep that posture. We put a brace on to train that posture. Now, if you've got back pain, back braces are very good in that they can help control pain, but they can also stabilise and allow you to keep riding and manage pain. If you wear a back brace, you need to know why and how, not just put it on and wear it all of the time. So they're just a few of the products that I prescribe. Now, very popular with middle-aged women who have a bit of a tummy, I've designed a wide waist, wide core support pair of breeches. They come in silicone or in a suede seat. So we've got a wide waist with an internal elastic support. We can take the belt loops off or leave them on. These are proving very popular with women who just have a bit of a tummy. At this stage, they're only available in black. So just to finish off, I do sell, having designed rider training programs. If people can't attend one-on-one, live, then I do sell training programs online. I've got a membership program, and this is building all of the time. I do run clinics, as I mentioned. I do rider assessments. Certainly work as a physio in all aspects of physio. Now, if you're interested in one of the riding programs, I have an e-book. Now, the e-book is also on the USB stick, and the USB stick has all the contents of the e-book, but the USB also has a number of videos, which is just videos of the chapters of the e-book. So that actually is very popular. It depends on how you want to learn. So as mentioned, these are my details. This is where I live. If you have any questions, any comments, want to talk to me about anything that you are interested in, have concerns about, you can get me through this email, aussieannie62@gmail. You can send me a text, certainly phone me, or you can get me through my website. So if you have any questions, don't hesitate. I certainly can answer them, or if I can, I will. I have a Facebook page. I put lots of tips and general information on my Facebook page, and the number of people following that is certainly building, and it's quite interactive. So it's just Facebook. You can do a search on applied posture riding and like and follow. As I said before, if you want any information, you can either fill in the subscribe form or just contact me through that, my Applied Posture Riding website. If you're interested in more information and reading about my manual, then you can go certainly through the website, and again, but just go to the Rider Trainings program. So I hope that's been useful. So thank you for listening, and I hope that you've got some more insight, some more information and education, not just on what I do, but about the importance of rider biomechanics. So thank you for your time.